The VHA has been rolling out AI or artificial intelligence for note-taking to record their appointment with the veteran. My line of thought is, does this help veterans with their VA disability claims? And I think it does. Okay. Now, how do I feel about AI in healthcare? That I don't know enough about it to even comment on it, at least have any comment worth its weight. But as far as note taking, how many times have you been to your VA provider, community care, or at a VA facility, whatever, and the symptoms you report are not recorded, yet you're trying to submit that evidence-based claim, whether it's for an initial claim, a supplemental, an increase here would be absolutely clutch, because if you have medical evidence of the increase, it doesn't matter what the CMP examiner says, because you can always revert back to your medical evidence. Medical evidence is always king, especially for increased claims. And I think AI tools would make that easier. What we're going to do is look at an article from Federal News Network, looking at VA, looking at AI tools to reduce workforce burdens, anticipate veterans' needs. Now, before we get into this, I do have one concern here. This is my concern here. We modeled it until we could get much more predictive in terms of who are the people that medical centers really need to reach out to and make sure they stay tethered. That's an example of using all our data to predict who are the people that we really need to reach out to. Initially, it sounds like a good idea. I have some reservations though, is how do we know this program is not going to exclude a veteran that really needs care? That I'm worried about that. Okay. It's like the national work queue issue that happened where claims were not being processed. They were ready to go. They were not being processed because of a program issue. And now that's claims, which are important. But now we're talking about healthcare, which is very, very important. A veteran could potentially not get healthcare because this AI tool says, hey, you're not important enough. That's how I interpret this. I really don't know. I really looked at this and tried to figure out exactly what they're talking about, but that's what it makes me think of. Okay, let's go ahead and dig into this article about how the VA is using this tool. Okay, so they had a 90-day tech sprint, and there was a ambient dictation, which is AI-powered note-taking. So as I'm recording this right now, so I use Premiere Pro to edit. And when I put this in Premiere Pro, I can click on an option and it will give me my text of my voice. It's not always accurate. If I use it, I have to go back and change some words. But if you look at my older videos, you'll see the AI generated text there. That's exactly what it is. Okay. And the AI would be taking what the veteran says and what the provider says and essentially making notes, making doctor's notes, which I think is a good thing. How many times are VA providers not doing that because of whatever reason? Probably time. So yes, I do think that this is overall going to help veterans with their disability claims, specifically on the medical evidence side. Now, all the other AI mumbo jumbo in healthcare, that's really, you can kind of, figure out what you think on that front. But AI tools can automatically summarize hundreds of pages of outside medical records. This is great. So for instance, service treatment records, private records, veterans that see the VA for the first time, I think that would be really, really clutch for them specifically. Here we have some ads popping up. Okay, thank you for that. Thank you. Amazon business, y'all. Okay. This person is this chief technology officer, said the ambient dictation, which is the note-taking tool, records a veteran's appointment with a medical provider and summarizes the appointment as a note for the provider to input into the EHR. This is electronic health records. The VA is making a large push and has tons of funding dumped into the electronic health records. Welcome to 2024, VA. Every time they have an interaction with the patient, they have to document it in the EHR. This is causing high levels of burnout and lots of time. So it is a time thing. It's definitely going to be good for VHA providers, that's for sure. I'm just kind of looking at it through the lens of the veteran for VA disability claims, personally. We're talking like blue button reports here, okay? So you should be able to see these notes in your blue button reports. Said the ambient dictation tool doesn't provide a direct transcript of the veteran's appointment. So not a transcript is used and isn't used for clinical decision making. Okay, so it's not a transcript and it's not used for clinical decision making. So there's obviously a lot of support the tool would give to that provider, okay? But not a transcript, just a overall of that patient's appointment. The physician is required to review the AI generative summary and sign off on it, as well as make any edits that are required. I think that is time consuming. I could see how the AI tool helps. I could see how this could also be time consuming. Absolutely. Now I'm curious if this AI tool does roll out, is the veteran's symptoms going to be recorded into the summary? You know, said named veteran reported 3 to 4 migraines per month. Would that be included in the summary? You would think so, because it's a symptom, right? Symptoms drive treatment. What does that look like? Susan Kirsch, Deputy Undersec for Health for Discovery Education Affiliate Network, said the ambient dictation tool is meant to give clinicians more time treating patients. This is a good thing. And less time taking notes behind a computer screen. I think this is also good because it's not being done correct. Not every provider is really good at taking notes. Let's just say that. We want to spend all of our time taking care of the patient, and the documentation over the years has gotten to be pretty high. It absolutely has. This person, Veterans Experience Office, said she sees AI tools as the key to providing a higher level of customer experience to veterans, as well as putting actionable data in front of people that are making decisions. Who are we talking about here? Surveys are great, but it's a lagging indicator. That's so funny. That is hilarious to me because of the VA trust scores and 91.8% approval rating that the VA has been pushing really recently. I just find that statement to be absolutely hilarious. Okay, from a data perspective, we're pivoting and we're really looking at all the data the VA has. In our minds, all data is blah, 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 and tailoring. Okay, so they're trying to make it better. Kit said the VA built an AI model on operational and clinical data, such as the last time a veteran came into the VA for an appointment and if there were any no-show appointments. And here we go. We modeled it until we could get much more predictive in terms of who are the people that medical centers really need to reach out to. And again, this is my main concern. How does the tool know who doesn't need to be reached out to? I think there's a lot of risk in this specifically. Imagine a veteran dying because of an AI tool said that they didn't meet the they didn't make the cut to get VA healthcare. Wild. Timely VA healthcare. Said the VA is also experimenting with generative AI to tackle administrative burdens. Okay, blah, 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 blah. Policies, information technology, rethinking success matrix. Said the team is rethinking success matrix. All right, and there we go. This is from Federal News Network. Okay, I'm going to have this posted in the pinned comment below. Let me know your thoughts on AI and VHA. I think there are good parts to it. I think there are some very, very heavy risk with that. I'm no AI expert by any means, but I don't know, man. It's that. Hey, Clay, you had a no-show. You're not really on our priority list, so we're gonna leave you to the wayside. I would caution any AI tool in any medical facility going that route, personally. But what do I know?